I got a thumbs up from Mr. Craig Graves. He is with us with another episode of Through a Therapist's Eyes. Is that correct, Craig? Or Craig? Is that what the thumbs up meant, brother?
It does. We are live and going.
All right, man. What is this? Episode 79, 82, 70, 81. I don't know what number we are because we got our shows all turned around, don't we?
Yeah, I kind of lost count too.
Well, it's just we've been recording different shows, and guys, we decided to do this one, kind of ad hoc, really, because of what our country, what our world really is facing. So, um, you know, through a therapist's eyes, right? What do we call this? The coronavirus through a therapist's eyes, maybe. I think I came up with the coronavirus special and mental health as the title for this episode 82. I am Chris Gazdick, and we invite you to see this crazy world of ours today through the lens of a mental health and substance abuse therapist to create emotional growth and knowing and realizing this is not the delivery of therapy services. Um, Boy, Craig, buddy, there is a lot going on in this world that you and I have lived in, and this is the human emotional experience. I propose let's figure this thing out together, right?
Yeah, yes. Yeah, I was thinking the other day that, I was born in 1971, and the things that have happened just in my lifetime are just mind blowing. We've had 9/11 and all the technology that's changed the world like it has. And now we got this crazy virus going on out there. This is
Yeah,
unprecedented times that we're living in. And
it really
just,
is.
it's amazing if you think about it that way, all the stuff that we've seen. And sometimes I think people would rather things be smooth, and probably I would too. But it's also kind of exciting, man.
That ain't living. You got to be living.
I'm telling you. I'm telling you.
Well, listen, we are going to talk about the coronavirus, and we're going to talk about the mental health aspects of coronavirus and the perspectives that we have as Mr. Graves, the coach that you have become, and the therapist that I have been, and we really are doing just an ad hoc meeting here to kind of talk about these things because we just know that. Well, I could speak for myself, Craig. I mean, I feel like we can really do a service, not so much in a medical field of doctors to disseminate information, but to disseminate information about mental health for sure. Because I'll tell you what, I'll start us off here by saying I'm going to coin a phrase, man. I don't know if anybody has uttered it, but I'm now documented when we publish this show. I think we're publishing tomorrow, right? So we're recording this on the 18th of March 2020. This
Yep.
going out tomorrow.
Yes.
Yeah, the psychological coronavirus diagnosis. What do you think about that?
I think it sounds good. I'm sure it's a mental health issue too, right? A lot of
I,
folks are
I
scared, and
oh man, yeah.
you hearing about it in your office?
Oh my God, that's all I'm talking about. So listen, we're going to go through this and we're going to talk about different things. I got an agenda kind of. Greg's looking at my screen. This is a little bit of a different show. I also want to have fun a little bit. We got to have some humor, guys. My gosh, we're gonna lose it. We're gonna lose our minds if we don't have a little humor. So, by no means, I want to qualify out front. If we're making any jokes or if I'm cracking a joke or something, we are not taking this lightly, ladies and gentlemen. This is a very serious issue that is attacking our world, certainly our country. So, this is a joke alert, man. I'm I've got a case of corona, Craig. You ready to listen to this? Did you hear that?
I heard that.
People have made that joke to me. I was literally sitting there thinking, man, I am going to err on the air and say I am drinking a Corona while I'm doing this show and admit to it. But truth is, I really didn't feel like having a beer. So that was bubbly, sparkling water. That was not a Corona beer, Craig Graves. You can attest to that.
Yeah, I see that. I see that.
So the show's funny too, man. So the audience, so you know where we're at. I'm in my building. We're zooming, trying to practice social distance. Craig, I didn't tell you this, but I thought you were just in California, and I want to demonstrate what we're doing. I actually kind of would have loved to come over been in presence and hang out, but I wanted to purposely make that point. Like, we really need to take social distance seriously. And you were just out of town and whatever. And so I thought that, we really need to Zoom these meetings and take that seriously. I don't have to wipe down my microphone and do all this disinfecting and all this kind of stuff. I mean, that's the world we live in, right? Have you been living in that world much?
What world's that?
Surfaces, cleaning surfaces, aware of what you're touching, all that kind of stuff.
When I was traveling, I was very aware.
Yeah.
Very aware. So I left. Tonight's Wednesday. I left last Wednesday and I went to San Diego and came back on Monday. And yeah, I was very aware, washing my hands. Kind of maybe obsessively, taking care of my surroundings and stuff like that.
Yeah.
Now that I'm home, maybe not so much because I haven't left the house, but except for to walk outside and did a workout outside today. The gym here's closed, and I've got a little home gym out there in my garage, so I did that. So yeah, but when I go out, I am definitely aware of my surroundings, and I'm not licking any toilet seats or anything like that.
Good. We gotta have fun, man.
I don't know if you saw that social media thing of the chicks licking a toilet seat somewhere. My God.
No, I did not.
What is wrong with people? I wouldn't do that if, there was no coronavirus.
Like a real meme or something of somebody doing that?
Yeah.
Were they trying to
No, I mean, it was
allay fears or whatever?
I guess so. I don't know what they were doing, but for real.
I did see a funny cartoon, Craig. It was what was it? My wife sent me a text. I think you can see this on this video. We need to do live stuff. Check this out, man. Where she sends me this picture. Maybe it's on Facebook. I guess it was. No, that's your text theme. Here she is. Can you see that and read it for him?
I can't.
Can't see that on the screen.
See it at all.
It says toilet paper problem has been solved, women. And she has an old lady standing with her hand on her feet, 1 foot on the floor, and her special private area is being blown out dry by the blower in the bathroom. We don't need toilet paper, everybody. Stop it with the toilet paper. No,
yeah,
man.
I'm not sure what's going on with that. That is just totally bizarre.
I will tell you what's going on from my perspective. It's a good way to launch into what we've got going on, man. I've been talking to my clients about this. I'm calling for 3 things. It's going to be a theme throughout this show. I really feel like we all need to be mindful and in the moment with these 3 things, and I think they're very, very important for what's going on with all of our emotions and everything that's going on with the coronavirus. First of all, we need discretion. Okay? We really need to make decisions, and I highlighted the decision-making episode 27. I want to refer listeners to that because you have all kinds of decisions being made throughout this process as business leaders, as I am a business leader, as a leader of a family, as a member of a community, as a member of the world, right? Like, we really are not only going to rely on our governmental people to make decisions. We need discretion. Decisions are being made, and you need to make them with your head and with your gut. And I want to refer to episode 27 where we really highlighted that. I think there's way too many times that people are making decisions with their gut right now, and our emotions are out of whack. That we all have, probably to a man, a woman, and a child, psychological coronavirus diagnosis. I mean, I think that's happening. So number 1, we need discretion. Number 2, and discernment. Discretion and discernment. And number 2, we need calm. Okay? We cannot allow fear to be driving. To answer your question, people are fearful, Craig, and they're going out and buying stuff and doing behavior that we don't need, like TP. This thing doesn't even make you go poo-poo. It makes you go choke, So we need calm. And thirdly, we need awareness. You cannot make good decisions out of fear, and you cannot make good decisions out of the disinformation and your whirlwind that goes on in your brain trying to make good decisions in that state. And out of also with awareness, you can't make good discernment when you're when you're just living naively and kind of blowing things off. So those are the three things that are very important that I've been talking to my clients about all day long and everything since this stuff is broken down. We need discretion and discernment. We need calm attitudes, and we need awareness of what's really going on in the world. What do you think about my big three?
I think it sounds good. I think it sounds good. I would ask you how you're telling your clients to get educated on the thing, because there seems to be a lot of conflicting and a lot of disinformation going on out there.
Yeah.
So, what would you say to somebody who's having some trouble with this thing, and you want them to educate themselves, because it almost seems like if you look at it, it's not as bad for people who are under the age of 70 who are healthy, right? You have underlying health conditions. There seems to be some potential concerns there, but it doesn't seem to be affecting the younger population as much as the older. So what do you tell people? How do you tell people to find information on it?
Well, I think that I'm not going to be an expert on information gathering. I think that you can answer that question, Craig, just as much as I can. I'd be curious what you would say about that. I don't want to degenerate into total 24-hour news coverage, although we're going to have to mention that with this conversation today. And I definitely do not want to degenerate into the political aspects of that. There are going to be times to deal with that in the future. Go to your election in November, people. Let's not politicize this now. We'll make that heavy point right now because I had that in my list. We need to stop politicizing this thing. Stop talking about politics, for crying out loud. All of us, straight across the board. There's a time and a place for that, and now's not now. That's not now. So, to answer your question though, I am kind of giving direct suggestions to everyone listening and to my clients and stuff. And this sounds contraindicated to what you would ask, Craig. Turn the news off, right?
Yeah, I don't disagree with that at all.
It is the way you get information, whatever your news source. Turn it on for an hour in the morning, get geared into it, and then turn it off all day long, and turn it on for an hour in the evening. That is all we need to do. That's it, and you'll pick up facts. You'll pick up what you need to know. I mean, you can't. I don't think there's an adult man or woman that hasn't been informed to some extent on what's going on. We all know the schools are closed. We all know pretty much when the restaurants and bars closed. We all know that the stock market is down. We all know that they're trying to pass some stimulus packages in the Congress. We all know that it started in Korea. From I don't know why actually.
China.
Huh? China. Yeah, I
China.
said Korea. I meant China. Thank you. And animal eating. I don't know. This is a joke. Can we just across the world agree not to eat animals that aren't supposed to be eaten? That's just a joke. But it is kind of serious.
Wow, was there some theory that they came from that?
Oh yeah, have you not heard about that? Now again, this might be disinformation, people, but so don't email in hate mail. But yeah, just people making jokes about. I thought you would pick up on that. People are saying the Chinese eat bats. Have you not heard that?
I did hear something about bats, but I didn't know what that meant. There's also theories it's a bioweapon, and
right.
there's a lot of stuff out there, man. It's hard to really know what's going on. It really is.
It is, but I think if you follow that prescription, man, and then I'm curious what you would say about how to get information about this. I mean, trusted sources like the CDC and your governor talking, the pressers and stuff that's going on. I mean, when you hear things consistently, that's going to probably tell you, what you need to know. And the fact is, if you get a little in the morning and a little at night, that's all you need. Because this came from a client. Here's a statement that's a good place to pop it in. Where did I write it? My notes and show notes on this one are going to be all goofy because I didn't really, it's just ad hoc. But it said that basically my client's quote that is, this can't be everything. Like that you cannot allow this to be, everything that's in your mind. It can't be, here's the quote, it can't be all consuming. I mean, we got to just, We got to stop that from consuming us. And getting information is something that people do and consume themselves with it.
Hmm.
Hour after hour after hour scouring the internet and news after news after news broadcast. And I mean, I've had more than one person in my office the last few days, Craig, with obsessive compulsive disorder. Oh my God, what a perfect storm for these people. You know, I mean,
What do you tell those guys? I mean, if somebody listening is in that category and they're not seeing a therapist, well, how do you help them?
turn it off. Do not research. You cannot consume yourself with it. I think that's even, diagnostically, when you got something like that going on in life, that is especially important. I mean, OCD people will get every fact that they can find, and just keep on and on and on and on and on and on with it. It's like it just won't end, because there's always more. There's always something I don't understand, and I'm telling them, turn it off, stop. Cornerstone of mental health, self-care. We're going to cover that other a little bit too. But what says you, sir? How do you get information? Where are you getting your information? What are you doing? How do you control it?
Well, I do look at cdc.gov, you know, and then there's various news sources, I think, out there. You have to look for them that are kind of middle of the road and just tell the facts. And, I rely on those for this and for other news too, even political kind of things. So it's not CNN or Fox News or MSNBC or any of those. It's some local guys, or I say local, but some independent guys on YouTube, man, and they kind of just tell it like it is, you know.
Yeah, yeah. Media people, you mean?
Yeah,
Yeah, I mean, I think that's what's interesting about this progression, the psychological aspects of people being able to do what we're doing. I listened to a podcast where I was able to hear a doctor in Italy. It's not Milan, Italy. Milan is not the city, but it's something like that. It's above a bigger city, and they have a huge hospital. And he was able to share his active experience in what he's going through, what he and his staff are going through, and how they're really experiencing this. And so, the internet is a great place to get information, um, and you'll find what you need through that to make good discretion. Because again, we're looking for awareness. Okay.
yeah, yeah, yeah. I'm not going to name names, but there's really probably three sources I listen to on the internet. One is more conservative leaning. The other two are more liberal, probably, but they basically tell it like it is, you know. And even the conservative guy, he calls, if Trump does something stupid, he calls it out. If Pelosi does something stupid, he calls it out. And it's kind of the same way with the other two people that I get information from. So definitely doing that. One of the crazy things I think is this theory that maybe it's not a theory if you look around these days, but the concern is with the older population, right?
Yeah.
There's so many baby boomers and older people in the country now that if they all get sick, it'll clog the healthcare system. Healthcare workers are going to get sick, be overworked, and that's the concern, right?
Right.
There are people posting on Facebook that this is the government implementing tyranny. It's going to be martial law. You're not going to be able to leave your house, and this is the Bill of Rights is out the window now, and that's really not what's going on, right? I mean, there's
Right.
a legitimate concern here, and that's happened in Italy. I've read from a couple of different sources that they're having to make decisions over there.
Horrible.
Because their hospitals are full.
Right.
And so you're a young man, you got two kids and a wife, and there's one bed, and there's an 80-year-old guy who's also going through some pretty bad stuff and needs care. They're telling that guy to go home, and they're treating the younger guy with the family, and he's probably going to go home to die.
Yeah.
And that's the situation that they're faced with in Italy.
It's real.
And it's real, and we don't want to be in that situation in the United States.
Exactly. Yeah, and I think the news media has gotten a good run on helping people be aware of that. Because That's what that doctor was talking about. I mean, Craig, it broke my heart. I mean, the guy's like very matter of fact and very, well, not matter of fact, very direct and genuine about what he's experiencing, which I kind of wanted to do on this show at some point too. At me as a human being and me as a therapist, what I'm experiencing in my office, I'm going to be genuine about that and share that at some point here because I think that's important. And I just believe in being genuine. This guy's sharing how he's actively, Craig, every day making those decisions. He has 50 new cases a day that are coming in, and they're already overrun. And his staff is just crying. He and his staff are crying every day, trying to handle the influx and what they're managing. And he shared that it wasn't so much that he's tearful and the staff is all crying because they're treating patients. They're used to that, and they're used to death, and they're used to those type of extreme situations. But what's really getting them is they're treating their clients or their patients are actually their colleagues, right? Because healthcare workers are right directly in the center of that, and so they're coming in and giving oxygen to their colleagues or now their patients, and at any given day that switches back and forth while all the time people are dying, and they're so wrapped up in everything that's going on. They're trying to call their loved ones every day so they can have that connection, but they forget to call the loved one, and then they have to call the loved one and tell them, well, their loved one died.
Mm-hmm.
These are the terrifying, horrible situations that, Craig, I think you're right. We're trying to mitigate through discernment and discretion to make as best as good decisions as we can now. And I believe all of our public leaders at this point, and I mean all, meaning all, are. Whether you believe that happened early enough or full enough or whatever, I think at this point it's got everybody's attentions, and I think even the politicians are not playing politics. Do you believe that might be the case?
I think I do see some bipartisanship out there now.
Yeah.
Um,
Only recently.
Only recently, only in the last couple of days, maybe even. But I do
Right.
think that that's what's happening. I hope so, because we're all in this together. This is nobody's fault, you know. Um, I think that the CDC and those guys did the best that they could. I am kind of troubled that our testing here in the States was so lackluster.
Oh man, I know it's.
At one time, South Korea was testing 10,000 people a day, and we'd only tested 10,000 people in total.
Yeah.
And we boast about having the most advanced healthcare system in the world. That's bullshit. That's just not true. If South Korea can test 10,000 a day, and we can't, we tested 10,000 total.
Listen, my good people in West Virginia, you saw that they were the last one to get a positive case. They were the holdouts, right? Well,
oh no, I didn't see that.
yeah. Well, my brother and I were talking, Craig, and part of it is because, there's a West Virginia mentality. I ain't sick, I'm fine. I'm good. Pump it on, rub it out. You ain't going to the doctor. It's just sniffles. Come on, let's go to the mines and we're fine. There's a mentality that's like, to hell with this, man. But also just today I saw that there was a veteran that was in having all the symptoms and nothing testing positive for the flu and whatever. And they told him, hey, you're 40 years old. We don't have any testing equipment in West Virginia. We don't have it. We're doing this only on a very as needed basis because it is so scarce. The testing equipment, particularly in my home state of West Virginia, and that bothers me too. I mean,
that's crazy.
Yeah, he went into a doctor like 4 times because he's like, dude, I know something's going on and I'm negative for everything. I mean, can you test me?
Yeah.
I'm like, no, sir. No, we can't. Like, oh, wow. Yeah.
I guess that, on the one hand, there's not much that can be done if you do have it. There's no drugs or treatment for it at this point.
Yeah, but let's talk about 2 aspects of that. One, you already did. I believe the curve stuff you hear people talking about and the overrun of the hospital trying to mitigate that so we literally save lives that way. But, So I'm going to take this off the agenda. Stop the politics on this thing if we haven't already, and if you haven't in your brain, stop. And then stop the news media criticism. I think that they're doing the best they can. The other component of that, Craig, that I really want to talk about is this one right here, man. Can you read that on my screen?
Let me see. The shame of diagnosis.
Stop this. Right?
Is there shame in diagnosis?
Let's be very clear and careful about this. This is a major part of the mental health factor, Craig. Yes. You know, I'm concerned about the emotional dynamics where I've got a cough and I've got an issue that doesn't feel right, and I've got a business, let's just say, or I've got a reputation in the community. I'm a big volunteer person. I've got a reputation of a upstanding citizen and a clean person, good hygiene. You see where I'm going? I'm a
Yeah,
good
but
person.
that's ridiculous. This is no different than the flu or the common cold as far as catching it.
Right.
That mean
But
you're
in
dirty or
but
doing.
in our head, in our warped, cyclical, crazy emotional process that we feel, that translates to the way that we think, it translates to the discretion that we have. Remember, we need good discretion, we need calm, and we need awareness. We lose our level of awareness when we say, well, what are my neighbors going to say about me? Is my business going to go under? They're going to quarantine me. The CDC is going to come and take me away. They're going to put me in something, cell somewhere. I'm going to be thought of as gross. People are going to look at me funny, like, oh my God, I don't want to be the next case, or I don't want to be the first case in my county, or oh my God, what? All of this stuff goes in people's heads, man.
Yeah.
And furthermore, if we're being honest, and you hear that person down the street in my neighborhood was diagnosed, oh man, I know that person. They never wash their hands. I've been in the bathroom with them before at a game, and I washed them. They didn't wash their hands. These people are gross. They're causing a problem. It, it's crazy.
Yeah, that's ridiculous. I can't imagine that.
I'm telling you, Craig, people are thinking all sorts of things with this sort of stuff, and shame is a big part of it. Shame of being diagnosed, shame of being, sort of. I mean, you do, don't you? When you get a diagnosis, you feel kind of gross. You're like, oh, did I screw up?
I never felt that way.
I don't know if you came across somebody with corona yet. There are a good chance that you're going to, and I want to ask you, if you're walking down the hallway and somebody comes in the building and says, hey, I'm grabbing my laptop, man. They've quarantined me. I just got tested positive. I'm gonna be home for a few days, man. And he reaches out to dap you, or he's like, yeah, I don't want to touch you, man, but hey, stay safe out there, right? I, if you have that kind of an interaction with somebody, there is a very natural, maybe not logical, sense of questioning, why him? What did he do wrong? What's wrong with him? This is an epidemic, and people are. I'm very fearful of the emotions. I'm very fearful of the fact that somebody would do that, get diagnosed, come in and say, "Hey, Craig, man, what's up, man? I'm just getting my laptop," and not tell you. Maybe they're sitting there thinking, "Oh man, I have such high respect for Craig. I don't want him to know that I just screwed up. I'm the first person in our company that's got this dadgummit, man. I don't want Craig to look down on me," and then not tell you.
That wouldn't be a good thing.
Right? And then you walk up to him and say, "Hey, man, you grab him on his shoulder, you know, and he not tell you, and then he freaks out or whatever." I mean, there's all kinds of crazy, real, and in the moment interactions that are shame based feelings that people are really struggling with.
Mm-hmm.
So does that sound convincing as far as something that we need to be really mindful of, caring for the sick? To me, that means reinforcing, hey, I love you, man. It's okay. you know, it I can say hello to you, and you're still. When you get this, you probably feel like my life is over. It's like a cancer diagnosis.
I don't. Do people think that way?
Yes, yes. I have people fearful of that, and they don't, and they just have a sinus cough. I'm
Yeah.
surprised that that sounds
Now,
shocking to you.
are these older people or?
No, no, man. Yeah.
Okay, so I was just. I mean, people got to not think that way. You know, I mean, remember that Bob Newhart thing? Just stop.
Yeah.
Just
Tell them
stop.
what you're talking about. I do.
Well, there's a Saturday Night Live skit where Bob Newhart's a therapist, and the person comes in and they tell him their issue, and they want to get help. You know, and he says, "Well, here's what you do: you just stop." And you're like, "What do
He
you
was
mean?"
mean about it too.
Yeah, and like, "What do you mean? Just stop, stop."
Stop it.
But seriously, I mean, I was just looking at some statistics while you were talking there, and are the people who are feeling this way, Chris? Are they older, younger, middle age?
I think they are. They're just of all ages, man. Really, I think either looking at other people as being faulty or wrong or
Well,
fearful of
you said
themselves. It's all of all ages.
you said that people said that they feel like their life's over when they if they have it and they just got sniffles or whatever.
Right.
So I was just looking online and I just found this article on Business Insider, and
Yeah,
I think
I'm gonna give you some sound effects, man. Done with that can. I'm gonna go with my next can. You ready?
Yeah. So this is as of today. The U.S. has had more than 8,000 cases and 129 deaths, according to a combination of the CDC and state-level data. So if you do the math on that, that's about 1.6% of the people who have of the 8,000 cases who have resulted in death. 80% of those are people who are 65 or older. And everything I've heard says that people who are at more risk of actual death are people with underlying health conditions. And so 80% of people apparently are very mild.
Right.
So, I mean, I don't want to get it either. And I'm going to be honest with you and transparent. If I got it, I would be extremely nervous, I'm sure.
Right.
But if we look at it logically, if we're not in that older category and we have good health, chances are it's not going to be that bad on us and we're going to recover.
Yes, this is why episode 27 is real, man. I mean, if you're just trusting your gut on this thing and you get a diagnosis or a friend gets a diagnosis and you're kind of totally freaked out, I mean, you're not using your head. And we need a combination. Because that is logical. But when you're shaken and you're anxious and you're worried or feeling shameful, logic goes out the window, man. I mean, it's not something that we are considering.
Yeah, logic is probably out the window, but it's based on what's going on.
Yeah.
If the schools are shut down, it must be bad. If the gyms are shut down, it must be bad. If people are buying all the toilet paper, it must be bad. But if you look under the covers, this is not going to extinct the human race.
No, but people feel that way.
Right. And we'll get through it. So I do think that you should do your homework. You should ask yourself if you're at risk in one of those at-risk categories. And if you're not, then perhaps your anxiety level would come down.
Listen, I'll tell you, I'm very nervous about my mom. I just went through a death I shared with this show in the listening public with my sister, and I don't want my mama to get this. She's older.
Hey, man, right? I'm not. Yeah, and I don't want anybody to think I'm blowing this off because I'm not. My mother's 70. My stepfather, I think, is 68, and he's got heart issues. He's had bypass surgery, and so yeah, I'm concerned for them, and I don't want them to leave their house.
Exactly. And my mother-in-law and my father-in-law, I just wanted to finish. I'm very concerned about those three people in my life. My stepdad, I'm not so much because I think he's a little younger. He's pretty healthy and he'd probably beat it off. but I mean, I totally agree with everything that you said. Otherwise, though, I mean, it's what I help people in my therapy office, and what I've been doing a tremendous amount of work with through this last week or so, is just helping people to I mean, Craig, you should see, man. My sessions typically start off, people are talking fast. They're they're rapidly speaking. They're mixing thoughts together. Okay, their sentences are kind of run on. I mean, they just start rapping through the news cycles that they've heard, and it's just boom, 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 boom. And by the end, because somewhere after they do that, I'm saying, all right, listen, stop. Let's get in a calm bubble here. We're not letting fear drive us. We're gonna let's shake through what we need to decide on doing, but like you have an empowerment to manage the way you're feeling, and when you do that, you can then think through the things like you were just laying out, I think, totally accurately. But if you
Yeah.
don't do that, you're gonna sit there and continue spinning.
Yes.
We don't want spinning.
That's right. That's exactly right. Take a deep breath, or more, or 4 or 5,
Yep.
or 10, and that's going to relax and calm you. And then go in there and ask yourself those questions. And hey, man, some people could be in those categories. Maybe some of the people that you're talking to or listening are older, and they do have underlying health conditions. What would you say to those folks, Chris, from a therapy standpoint?
I talked to one right off the get-go. I said, do not come back here. We are going to do teletherapy, and she was grateful.
Okay.
Absolutely. I was that direct. I was like, I don't want to see you again in this office, because she is way high risk, and she knew it. She was like, yeah. And we did that, which more on that in a little bit about teletherapy and what's going on in mental health. But I didn't want to lose your thought there, because what you're talking about is also the opposite side. Remember, this show is driven on discretion and discernment, having a calm attitude, and having awareness. A calm attitude, so fear is not driving us. Awareness, so that we are not naive or numb. Because I'll tell you what I've also been able to do as a service to some is bump up their level of awareness. There are many, many people that actually are out there thinking, this is trumped up. This ain't that big a deal. My gosh, why is everybody all worried about it? Why are they shutting my stuff down? Why, whatever. They're going to the bars and and I'm not talking about just the millennials. We got a problem with all these young kids, running around, not respecting social distancing practices. And so I've actually increased people's awareness. Like, no, wait, this is a big deal.
Yeah, it is a big deal, Chris. So I was just sitting here doing I'm a numbers guy, right? So I was just doing some math. And if I take that 8,000, and it said more than 8,000. If I take that 8,000 and I figure in the number of deaths, it's about 1.6%, right?
Yep.
There are 328 million people in the country. So you say, well, that's a small number of people who actually have it, which is true. But if everybody in the country gets the coronavirus, every man, woman, and child, and 1.6% of the people die, that's like 328 million, 3 million people.
Right.
That would die as a result of this outbreak.
It's crazy.
And that's pretty serious, man.
Yeah, it really is. Now, this show is not a dissemination of information. I'll make that point again clear. And this is just what we have heard and goes along with what a lot of other people have heard. I'm not an information specialist on this disorder, neither are you. But to give you an idea, there were people that were talking about just Monday. They postulated that might have changed some of the politicians taking it seriously views. A study came out of London that if we are running the same course as we are currently, and maybe as Italy went, the fact is that 2.2 million are set to die in the United States.
Yeah.
I mean, that's because honestly, the cases that you just did, maybe you just said everybody had caught it 100%.
Well,
You know,
that's a
that,
hypothetical, and I haven't
totally.
heard anybody say that. I've
Right.
heard different things from different doctors. Some doctors have said somewhere between 50% and 70%. But those are all estimates.
Right.
I was just making a point that
The
if
point,
everybody got it, there would be a heck of a lot of people who would not survive.
and the point there is, with the swine flu, I looked it up with the CDC as a conversation I had in my personal life. There were only 18,000 deaths in this country and some change from the H1N1, and we're talking about at least that, man. I mean, this potentially is way bigger than that was for whatever reason. Way smarter people than I would know.
Yeah.
But I am increasing awareness about this. Like, we can't have numbness just as much as we can't have fear and overreaction. We really can't afford underreaction either.
Yeah. Well, and that was my point. You had said that some people are saying, "Oh, it's just trumped up, it's BS, blah blah
Yeah.
blah." My point was, it's not. If there is very low death rates, it seems somewhere between 3-4%. The math that I just did with that from that article is 1.6, and if everybody gets it, then that's I redid the math. So 328 million times 1.6% is about 5 million people.
Yeah, it's staggering when you really get to thinking about it, Craig. And I think that's what people are doing is they're thinking about it and thinking about it and thinking about it and thinking about it, and you're riding yourself crazy with it, or you're kind of blowing it off and saying, "Hey, you know what? Poo-poo. This ain't whatever. This is annoying. I don't know why we had to do this stuff." And I think we need again discretion and discernment. We don't need to overreact. Can't be underreacting. Is our point here? Let's highlight the cornerstone of mental health. How do you suppose the cornerstone of mental health, self-care, has anything to do with this, this deal here?
Well, I mean, you got to take care of yourself. You got to be eating right. You got to be washing your hands. You got to be, not putting yourself in risky situations at the moment. Those are the things that I would say.
Now, mind you, from my therapist's perspective, I use self-care to define as fun, enjoyable activities that are relaxing, that help you to unplug from the world, that are not self-destructive in any way, and that are not work-related tasks. I couple self-care up with the triad of physical care, which is what you're talking about with the body and everything, and also relationship care, which is the same thing as self-care, just with your partner or with someone you're in relationship to. So self-care is the mental health characteristic of taking care of yourself, the emotional taking care of yourself, unplugging. How do you do that in the area of quarantine? How do you do that in a time where the things I do, well, I can't go golfing, it's closed. Well, I can't go out and eat and go to restaurants go on a date. They're shut down. I can't go to the movie house, and what am I going to do? I don't have the ability to go play basketball. Well, I mean, a lot of stuff that people use to really unplug is suddenly, in the course of a week, like gone.
Yeah.
It's all gone.
Yeah.
Now, you think about that now. Let's just take movies. If my big thing is every Friday night I go to the movie house and I'm checking movies out, and now you take that away from me, and I don't have much other that I do, I'm really stuck. Because a lot of healthy people out there, I mean, they have the things they do. They do self-care. But what do you do when maybe not only one of them, but 2 or 3 or 4 or 5 of the things that you do? How about all the gym rats out there? Okay, that's what I do. I go to the gym. I work out. I lift weights. I run the machines. I have my thing. That's what I do. It's my routine. This is what I do 3 days a week or every day of the week. This is where I start out my day. Gone. Now what you going to do? Right?
You're going to do something different.
Right. And I think that's the main point I want to make. It's that this is not an option. Like, you have got to do something different. Because if you don't unplug, you will make yourself nutty.
Yeah. There's a video out there. We talk about Jocko some on the show, Jocko Willink, and I think I've showed you the good video, right? Have you seen that one?
I think you have. You refresh my memory.
Yeah, so he said he had one of his the guys that worked for him would come to him with some problem, and every time he came to Jocko with a problem, Jocko would say, "Well, good," because he
Oh yeah.
there's something else could go like we didn't get the high speed equipment we wanted. Good,
I'll say good.
Didn't get the mission. Good, we can plan another
Good.
one. So, I mean, I think you got to have that kind of attitude. So I actually shared a post to my Facebook before we started recording, and I'll try to put this up on the Therapist Eyes Facebook page so you guys can see it. But with all the craziness, now my Facebook's not going to load, so I can't tell you what I wrote. But it was that, the gym got closed. Good. I'll save gas money from driving to the gym, and I can work out at home. School got closed. Good. I get to spend more QT with my kids. Grocery
Right.
store out of food. Good. I needed to fast. Needed a longer fast. So I mean, just look for the alternatives that still bring you some joy and still allow you to do the things that you want to do.
So I can't go to the gym. Good. You get to find 3 more things that you enjoy. What you're talking about, I didn't really think about it when you shared that with, I think you shared that with our mastermind group, Craig's, where we originally talked about that.
Probably so.
And the fact is, that is cognitive therapy at its best right there, brother.
Yeah.
That is cognitive reframing is what we would term that as being.
Stock market's down. Good.
Good.
Now's the time to invest and make a fortune.
Absolutely.
Because it'll come back, Toilet paper's gone. Good. Time to buy a bidet,
Yes. and you're saying that sort of matter of factly, but let's get dramatic with that, man, because if you're successfully minded people, you like the Unbeatable Mind program, like to develop an unbeatable mind, to be successful, to be mentally healthy, you have got to be able to reframe things that are tough, that are scary, that put you out of a comfort zone, and find a way to flourish there. Find a way to get through. I'm leading a company, and people are bringing to me, concerns and problems, and I'm kind of just calm, and I'll stop and I'll think, okay, good. Well, let's do this. Okay. Well, let's not worry about this. Like, I'm trying my best to use good discernment and discretion so as to get that balance between, we're not going to be all freaking out here. Okay. But we're needing to make good decisions and be aware of the reality of what we're facing. Right.
Right. Yep.
So you reframe yourself out of that fear statement, out of those negative statements, and you literally are empowered to do exactly what he says and what you just talked about. That's cognitive reframing. Did you know that, man?
Did not.
You're a cognitive specialist, brother.
I didn't even know it.
Oh, let me see. Where do we want to go, Craig? There's several things to talk about. I am going to tell the audience this. I told you this before we turned the mics on. I really feel honored to be able to spend time with you guys across the country. And we have downloads across the world. And maybe right here in the middle, I want to say, for the folks in Italy and Uzbekistan and, Australia and Great Britain, I'm calling out places that we have listeners, that we know we have listeners. They're struggling in Italy. I don't think we actually have a lot of listeners in China, Craig. We haven't had one, have we?
I don't recall seeing one. No.
Yeah, I don't think we have. But if you know anybody, because we have listeners in South Korea and I think Japan, if I'm not mistaken, just listen, people all around the world. We're all together on this one. This is and Craig, I can't speak for yourself, but I'm really honored to be able to provide a little bit of humor, provide a little bit of information on mental health, and be at least a voice to kind of just help us get through this thing, man. We all got to come together, and we're not going to worry about the time. I've got a clock ticker running. We're probably going to run over our regular length of it because I feel like we're hopefully a little bit helpful to people just listening to us who's gotten to know us through this show. Craig, when you're going through something crazy and you hear something that sounds familiar voice, or something that seems normal in a time that ain't normal, it's comforting. And so if we're able to do that for anybody, we want to spend a little extra time with you. You down with that? You agree?
Yeah.
Who was that calming voice for you? You know, I'm thinking of like Dan Rather when I was a kid, up into my adult time. You know, it's like crazy things happen, and he comes on. It's like, oh, Dan's still there. He's still around. You know?
I don't think I have a calming voice these days, at least not on the TV.
Well, probably not these days. Yeah, that's unfortunate, but you know, that's a whole nother story. Anyway, maybe I was just going to kind of transition to say, you know, kind of what's going on with me. You know, a lot of people are probably wondering, you know, what do people deal with here? And you know, as a therapist have emotions and all this kind of stuff. You know what, Craig? I'm going to be honest with you. I have been drained at the end of the day. I mean, really. I mean,
we're talking about this issue?
Yeah, man. You know, in helping people all day long, people are all the time asking me, like, how do you deal with that, man? People bring problems to you, talk about problems that they have all day long. Like, I don't know that I could do that. Da, 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 da. And I guess for me, it's kind of like, you know, doctors, they treat patients all day long, and you kind of get accustomed to that. And you figure out ways to manage your own burnout and your own, they call it compassion fatigue and that kind of thing. Well, you know what I realized, man? I got my own emotions with this thing. You know, I think that's why I'm coming home and being so drained. You know, because you know it's like let me get ready and gear up for the next day, because I mean I'm dealing with my staff and you know calming people down and you know dealing with decision making and you know just people in my personal life and my own battle with, like, you know, for instance, I was totally tuning out. You know what I've been watching right now lately?
What's
Hell
that?
on Wheels, man. You ever see Hell on Wheels?
I don't think I did.
Oh, dude, it's an awesome show about the railroads being built. Shout out to my father-in-law. Gerald turned me on to it. He was a railman all his life, so I just been loving this show, man. It's pretty violent. I swear that everybody in this show has drank more liquor than you and I probably combined in our entire lifetime just on the set. Because it's back in the old days, man, when they was building the railroad stations and stuff. So I'm sitting there watching this, and I got a text early on in the week as all this was going on from one of my staff, and you know, a colleague of mine was like, oh, I'm thinking this is what I want to do. What do we think? And I'm like, I remember I turned over to my wife. I was like, man, I think I got to turn on the news and see what's going on. I don't really want to, but I just needed to get informed. You know, I didn't want to do it because I need to turn it off. So we can't always turn it off. We have to tune in. You know what else I thought would be interesting, Craig, to talk about what's going on in. Well, before I do, what's your emotional state with this? You just said you kind of working from home, so that's not too different for you and whatever. I mean, check in with just what you're thinking around all this.
You know, my emotional state's fine. You know, I did travel, and so obviously there's a little bit of concern there for me coming back, you know.
Were you nervous in that airplane?
No, not really. Not really at all. No.
It was still early on too, wasn't it, though?
Well, I mean, I just flew home yesterday, so
that's right.
or Monday. I'm sorry, Monday. Today's Wednesday. So, you know, things were getting crazy by then. But while I was in San Diego County, they had 5 new cases show up, and they started canceling events that were bigger than 250. You know, our event was smaller. And so, you know, there were obviously some thoughts about it there. Some thoughts about but overall, I mean, I think that my mental state's probably pretty good.
You know, I'm reminded of one of the shorts we did. Do you remember the one, Is Craig Calmer?
Yeah.
Dude, I have seen that in you, man. The coaching strategies have absolutely worked. Because I know you're working them intently.
Yeah. I you know, I do feel more centered and grounded than I have been in the past.
Well, I think we've all got to be aware of that. You know, there's a lot going on in the mental health field. This you probably don't know much about, Craig, but what have you heard about? I am curious from just a normal Joe's perspective, as far as, you know, what's going on with the mental health field. Do you know or understand, like, with medical treatments, and what have you heard about mental health in this whole ordeal?
Uh, I really haven't heard much about the mental health aspects of this thing. You know, I think I did see some people fighting over toilet paper in Costco
Literally,
or something like that. I didn't see it myself, but there was a story about it.
client told me today somebody, literally an old lady, got pushy and physical over a jug of milk.
Yeah.
Come on, people.
The food supply is not going to get cut off. We're still going to have water. So I'm not sure what the panic is from that standpoint. But yeah, I mean, it could get crazy. Fear is the biggest enemy. Fear is even a bigger enemy than the virus itself, probably, because if people start losing it and panicking, then that's where it's going to get bad.
That's where we get the psychological coronavirus syndrome.
Yeah, you could get killed over a gallon of milk in Food Lion.
Yeah, man.
You'll probably survive the virus, but you get murdered in Food Lion trying to buy a carton of milk.
Yeah. Well, there's a lot going on with mental health in this, and I think that people really need to know and understand about that, because there's I feel like, Craig, you have said before that when you look at health conditions, the mental health condition is right on up there with this, man. And I feel like that the mental health factors that are going into people, I mean it, the psychological coronavirus syndrome is real. I think, if I'm coining that term, I mean, the reality of it is that people are not knowing how to get therapy. People are sorry about the mic. I'm not used to the mic, man. Craig just chatted with me. Hopefully I have weird sounds with the mic. We are using a lot of telehealth now. So there's a lot of people that cannot access their mental health care. It's disrupted. They're in quarantine.
Mm-hmm.
I just had somebody today that was in quarantine, right? And you have a relationship with your therapist, and when you have anxiety or depression. So look, remember this Tale of Two Tapes I talked about?
Yeah.
Major overview of mental health. You got a biological reality going on.
Mm-hmm.
Anxiety, depression, OCD is like the perfect nightmare right now, But then on the other side of the biological continuum, you got social and emotional realities, okay? So you got a big one right now. And, oh, by the way, why don't we just throw in financial arguments with our spouse? Why don't we just throw in, oh, my God, what's going on with my kids? Oh, they're driving me nuts. They're getting cabin fever. This social and emotional increase, let alone what we're talking about with the fear-based feelings about the diagnosis and the condition in the first place, you've got a major compiling of stuff that's kind of together.
Mm-hmm.
And so mental health care becomes really, really important. And I must say that they have moved kind of quickly to help us, be able to do teletherapy. A lot of mental health clinicians, I presume across the nation, as many EAP clinicians tell me as many as 60, 70% are switching and doing full-blown teletherapy and, talking to people on the phone and being able to bill your insurance for that. And they're reportedly decreasing HIPAA regulations so that we can increase access, with platforms that people can use. I mean, you're supposed to, follow HIPAA recommendations for buying, purchased, encryption-based software and all this type of things that, I mean, listen, clinicians have not caught up to speed with a lot of that stuff. And we're really kind of ignorant about how to use those technology-based things, particularly if you're therapist, not picking on the older people, but 50 years up and older, man. I mean, my mom just retired not too long ago from the field, but I had to hold her hand just how to do a Word document, Bless you, Mom. I love you, but dang, right?
Yeah.
So we are doing all kinds of, reach out to your clinician out there, guys and gals. They can talk to you on the phone and use your insurance. And a lot of us, and Craig, believe it or not, I'm still doing face-to-face stuff. I've got protocols in my office. Took almost all the chairs out of my lobby. We're doing social distancing. I mean, I don't shake hands with the kids. They ain't playing with none of my toys. No throwing the ball back and forth in my office. trying to make good discretion decisions and have good discernment about how. But the face to face, I mean, I can't tell you how many people have really appreciated me doing that. And they're like, man, it just means a lot that you're here,
Mm-hmm.
And I'm like, yeah, I want to do that as long as it's safe for me, is reasonably. And, by the way, express some appreciation for the healthcare workers, man, the nurses and, the direct responders. They don't even have equipment to put on gloves when they're going to a car wreck, all that
Yeah.
stuff is short, and our healthcare workers are working hard.
Mm-hmm.
So there's a lot going on with mental health in the field, and it's based on really increasing accessibility.
Well, I think the telepresence thing is a good thing. I met a therapist recently who's doing that.
Yep.
Yeah, she sees clients through Zoom sessions and stuff like that.
Yeah.
Some of them, not all of them.
Yeah, a lot of us are doing that now, particularly even just the telephone, just because, like I said, man, people need access.
Mm-hmm.
They really need access to something that has really helped them. Now, it's an interesting thing, as I was just sitting there talking about that. I'm curious to see how initial appointments are going to go.
Yeah. Are you just starting it up? Are you just starting to do that?
Do what?
Are you telepresence deals or?
Oh, yeah.
Soon.
Oh, yeah.
Okay.
Yeah, most definitely. Yeah, I have a lot. I just kind of.
So if you're in North Carolina, listeners, you could talk to Chris.
Well, now, wait a minute on that. That's not so. There is still, you got to be licensed. I'm not licensed outside of North Carolina, so
that's what I said. North Carolina listeners.
Oh, good. Yeah, you got it.
Yeah.
Yeah, we could do that. We could do that. Particularly now they're making those, for time limited purposes, while we're dealing with the coronavirus crisis, they're making special provisions for that. But, it's interesting. I have not really had new appointments. And I'll be curious to see how that plays out, because I think people are afraid to come into an initial therapy session anyway. Terrified. It's overwhelming.
Yeah.
How do you do that in the context of all this?
True.
And that sucks, because they probably really need to, if you're thinking about doing therapy and you're already stressed out or things were going on and you're kind of second guessing doing that now today, a clinician will be able to receive you. Okay. You don't have to wait till the coronavirus is out. We can be helpful. Please reach out. What about the kiddos? What are you thinking about the kids, Craig?
My daughter was a little nervous about it the other day. I had to have a conversation with her. But other than that, I don't know. I haven't obviously seen her talk to any other children. None of her friends have been over. So I'm not sure how they are taking it. I tried to reassure her that things were going to be okay. And, I told her that it was mainly the older crowd that was, really at risk. And she said, well, Daddy, you're old. So, but she's concerned about her grandparents. And
she's concerned about you old fart.
Yeah, true, right?
Well, yeah, and I'm glad that came out that way, because I really want to make a point about the kids, man. What she expressed there, she really does see you as old. We got to remember, kids might seem like they're not tuned in. They seem like they're not dialed in, but I'm going to tell you what they are. They are absolutely engaged in, when you're listening to the news, they're checking it out. They know the panic. They may not show you, particularly your teenagers. Your teenagers are dangerously probably numb and blowing stuff off. But kids, they see you as old. I mean, we made a joke about that, Craig, but she might very well think that you are higher at risk.
She probably does, but, I assured her that it was people who were much older than me.
I'm going to be honest with you. I did not even think about talking to my kids, age 18 and 15. I really didn't think about having a conversation with them until I heard somebody on the news say this would be a time to set your kids straight. You know, don't forget to be honest with them. Tell them, hey, this is a big deal. We need to be careful.
Yeah, I'd bring it up with them. How are you doing with this?
Right.
What are your thoughts? What have you heard?
Right.
So I'd be proactive in that respect.
Yeah, and as with most things with kids, I really feel like we need to make sure that they know that they can ask questions. If they know that they can ask questions, because they'll be ashamed at asking questions. I mean, they'll be like embarrassed and not want to look stupid.
Yeah.
And so they got to know, look, yeah, it's okay to ask questions, and let's get them the information that they really need. They need to be able to be calmed as well, because I've spoken to more than one kid in my practice, and they're freaking out too, man. Their lives are over. Their lives have changed. They're not going to school. They're not able to hang out with their friends. They're not able,
Yeah.
My poor kid, Craig. Guess what happened? You don't know this because you've been out of town. We haven't talked. My poor kid lost his phone somewhere at like school, and this was like what day is today? Wednesday. So this was like Wednesday or Thursday last week. He lost his phone and wanted to go ahead and get a new one or whatever, and we ordered it on Amazon, and it wasn't supposed to be there until like Friday. And so this kid has not had his ability to get tapped into his buddies, right?
Wow.
Yeah, terrible timing for him. I feel bad for him. It's awful. Which, by the way, back to the idea of self-care. Listen, connect through FaceTime, adults. Listen to your kids. Your kids will teach you how to Snapchat. Basically, use social media to reach out. That's an advantage. Don't be alone with this sort of thing. It's kind of why I'm excited and happy to be able to do this show, so you can hear a little bit of normal voice that you've heard before. We're here after. We're going to be here. I mean, reach out to people. Loneliness is dangerous in times like crisis. You don't want to go through stuff alone. Don't want to be alone. You want to be connecting. You want to be connected.
That's true. That's very true.
Stay dialed in.
It's good advice.
So kids' perceptions and their anxieties. Where do we need to go here? Focusing on the reality that we will get through this and avoid the negative thinking of disasters on epidemic proportions. I think we were talking about that earlier, Mr. Graves. I think you nailed it with this went wrong, well, good. Well, that went wrong, well, good. We'll do this, Would that come from Jocko?
Yeah.
That nails it a lot, because I thought that might be a little bit of a summary that we kind of start pulling on to. We need to focus on the reality, but the reality isn't the bleak thinking that you might be falling into a trap with. The reality of it absolutely is there's not an information show. I'm not an expert on COVID-19. I don't know anything about corona. I couldn't identify it for squat if you put it under a microscope, but I absolutely unequivocally know and understand and believe that we will get through this. This will come, and it has come, and this will go. And honestly, we'll probably have another one of these years down the road.
Probably will. I think probably will.
How's your dog, man? I love it. That's fine.
She's fine.
It's a good thing I'm not in the room, man. Tell him what would happen if I was in the room.
Yeah, she doesn't like Chris at all. It's not pretty when he comes over.
She really, really doesn't. She was. You left me at home while you was doing something one day, Craig, and I sat there, and I remember. I think I told you I was bound and determined. I still am bound and determined to make friends with that dog. I sat there for 15, 20 minutes, just being calm, just kind of playing, looking at her, just kind of, looking down, looking away, relaxing. You know how you do with dogs. That dog barked at me incessantly for 20 minutes.
Yeah, she doesn't like you, bro.
I didn't do anything to her, man.
I don't know what it is, man.
Well, you got to tell the audience, man. It's got something to do with men. It ain't got nothing to do just with me, right?
Yeah, it's men in general. She's not a fan.
How do you want to start summing us up here, sir? I'm looking at discretion and discernment. I've repeated that over and over again to my clients. I'm looking at a calm attitude, not allowing fear to drive us. I'm looking at awareness, so that you're not allowing yourself to be, ignorant or numb to the issues that are real around us. I really felt like those were the three main killer aspects that we really need to be nailing down in our own psyche.
Yeah, I agree with you. You know, got to be educated. You got to look at it logically and turn off the news, and we'll get through this, man.
Absolutely. Well, I think I just looked at the clock. We didn't go too much over, man. I'm kind of proud. We stayed in a little bit of a level mind.
Good deal.
We have recorded shows. We have shows pre-recorded. I don't know what number this is. I think we did this one special, so it's coming out tomorrow. We got an awesome show I know that I recorded. Man, that was weird, by the way, Craig. I did one without you.
Yeah, I was traveling, and Chris did one without me.
That freaked me out, man. I was like, this ain't right.
So, of course, it won't be as good as the others, but you know.
Right. We did okay. We did okay, but it was a mom who shared her story of being a mother to opioid and heroin addicted kid, and that was a really good show. And we do have a commitment from a musician in the California area that's going to come on and talk to us about her stories. She's actually from France. Holy cow, Craig, that's going to be awesome to be able to talk with her about France, and what's going on with their experience over there. I imagine she still may be in touch.
Yeah, it will be interesting to hear that for sure.
It really will.
Yeah.
She's an up and coming. I guess she's going to be famous, or already is famous. I honestly, so that'll be fun, and just some other things that we got coming up on our show, guys. So glad to be with you. Hope we had a little bit of fun, poked a little bit of fun, and calmed some anxieties down, settled down some fears, so we can have good decisions made and be aware of what's going on. What says you, Craig? You take us out of here, and we'll see you guys next week.
Yeah, through whattherapistdoes.com, you can find out all you need to know about Chris and me and the show. So we'll talk to you guys soon.